The summer surge is seeing about 460 San Diegans hospitalized with COVID-19. That's 4 times what we had back in May, but it's still less than previous surges. And this wave of hospitalizations is different in another way.
It is across the board much less acute.
Sharp Healthcare has the most patients hospitalized with COVID at around 160. Chief Operating Officer Brett McLean says the good news is fewer San Diegans are needing to be admitted to the ICU or put on ventilators.
The overall picture absolutely is a less acute variant, thank goodness. That said, we are seeing a similar surge of a higher acute nature with those that are older.
It's unclear if officials are seeing less severe illness because the new BA.5 variant is milder or due to the wall of protection built up with vaccinations or previous infections, or even a mix of both.
We certainly have less patients with this surge who are requiring ventilation than ever before. And that's great because our antivirals are working.
UC San Diego Health's Chief Medical Officer, Dr. Christopher Longhurst, says he's also seeing some patients presenting with milder illness, and their data shows recent infections aren't as deadly as before.
What's circulating now probably has a mortality rate less than the flu.
Recently, a Los Angeles County USC Medical Center official said just 10% of their patients admitted with COVID are actually being hospitalized because of it. But Longhurst says they aren't seeing that in San Diego.
Up to 2/3 of patients we're admitting to the hospital are being admitted for COVID as opposed to with COVID. The LA County data seems a little bit off to us.
Many San Diegans hospitalized with COVID have underlying medical conditions that the virus makes worse. So it can be difficult to pinpoint what's driving the serious cases.
It's kind of the combo of that, and we just don't think it's helpful or appropriate or even valid to be able to pull out the because of or due to.
Scripps health officials also maintain the majority of patients in their hospitals with COVID are admitted because of COVID. Chief Medical Officer Dr. Ghazala Sharif says they're finding about 10% of hospitalizations are incidental case findings.
Which means that people are getting tested for procedures and they don't even know they have COVID.
COVID aside, officials at Sharp and Scripps are seeing unusually high volumes of non-COVID related emergency room and urgent care visits. And there's another persisting issue, hospital staffing. Sharp alone had 700 employees out with COVID on Thursday.
We have to replace those staff, right, with others to be able to take care of the patients.
The staffing shortage, along with the unpredictable nature of COVID surges, has made it hard to run a hospital.
Are we going to get to that crossroads at some point where we have to start delaying surgeries again? And none of us wants to do that. So I think it's a time for us to all take a pause. We all know what to do. Just be extra careful.
With infections rising, officials are recommending people use the state's CA Notify phone system. It was pioneered here in San Diego, and it can let people know if they've come in close contact with someone who has the virus. Matt Hoffman, KPBS News.